Well, while many people are now ready to embrace the new year, a lot of San Antonians are, unfortunately, starting the year off sick. Emergency rooms are still packed. But how do you know what you have and when you should stay home? KENS 5 reporter Andrew Moore spoke with University Health System today. Andrew, what did they tell you?
Yes, as ready as many of us are to leave 2020 behind, it's still flu season, allergens are still bad, and COVID-19 is insisting on hanging around. But how do you know what you have, and when do you need to go see a doctor? Well, here's what a local epidemiologist had to say.
The top offenders right now, flu and RSV, which we've been dealing with for a while, they seem to be decreasing a little bit, but COVID seems to be raising its head again.
The main culprits making you feel lousy right now are flu, RSV, COVID, and allergies like cedar fever. And while they have similar symptoms, University Health epidemiologist Jason Bowling says there are a few ways to tell them apart.
If you're having a fever, you may have seasonal allergies, but you have something else going on as well.
Allergies shouldn't include fever or body aches, so if those are current symptoms, take allergies off the list. And a negative COVID test can take COVID off the list. Flu and RSV are still very close, but the difference may not matter unless the patient is very young.
Especially younger kids, less than 2 years of age in particular.
So when should you go see the doctor? Bowling says even with fever or body aches, you can probably stay home. But if there's an issue with your breathing,
chest pain or chest pressure, tightness in your chest, shortness of breath, particularly at rest,
you need to go in. He also said suddenly having confusion, memory loss, or difficulty staying awake are reasons to see the doctor too. Finally, when should you go to work? Bowling says you shouldn't work if you are still having symptoms from a virus or if you have a fever. A good rule, he says, if you need pain medication to make it through the day, you aren't well yet.
If you're having to use medicines to keep your fever suppressed, that doesn't mean that you're fine and you can go into work, right? That means that you're using medicines to keep yourself feeling better.
Lastly, keep in mind, these aren't the only viruses running around. There's also something called norovirus that can cause stomach pain, nausea, diarrhea, and vomiting. Bowling says that if you are very ill, please try to go see a family doctor or go to an urgent care location before you go to the ER because ER locations are already extremely crowded right now. Deborah?